I'm the only one who knows what it's like to have the brain bleed inside my body. I know how I feel in chemotherapy. I know what it was like to be in the coma. I know what it's like to have the hemangiomas. So I have really valuable information that nobody else has.
A friend of mine, a radiologist here in town, contacted me. And she said, Les, there's someone that I want you to meet who wants to make a difference in health reform. I thought perhaps it might be another physician or another policy leader. But in fact, I was introduced to Peggy Jo, a patient. Peggy Jo has a condition that no one has been able to diagnose. She's a beautiful, articulate woman who doesn't know how long she has to live. I met Peggy Jo in her home. She showed me her guest room, and in it are boxes. And she said, Leslie, somewhere in here is my diagnosis, and somewhere in here is my cure.
Healthwise has always had a real focus on advocacy. The way most people know us is through our solutions, but just as important is our work in Washington, D.C., helping set policy, rules, regulations that make it easy for patients to play a more powerful and active role in their own care.
Where can people make a difference in their own health care? Where can a group of people make a difference in their community? Where can a whole movement make a difference in righting some of the problems that's wrong with our healthcare system? And that's where Healthwise wants to be.
If you think of Healthwise as policy, advocacy, and solutions, each helps the other. Without the solutions, our policies are just words. And without the policy, we have a hard time to get traction on the solutions.
Peggy Jo was so passionate about how she thought she could help. It shamed me, thinking of all of us in healthcare who have not provided an ecosystem so that we can retrieve information easily, so that we can look at patterns of illness, of symptoms, of treatments and disease, and come up with something hopeful for people like Peggy Jo. And Peggy Jo says, I want to be in the know. I want to be in the care team, in that inner circle. I want to be figuring things out, digesting it together, working together. I want to live.
I have really valuable information that nobody else has. And there's no place in our medical records that that voice is actually documented. And that's really frustrating to me, because I want to be a part of the group. I want to be inside the circle. I want to be talking about it. I want to figure it out. I want to live.